Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Richard Hurd from Gastroenterology Associates of Columbus, and we're talking about a topic that not everyone knows a lot about and a lot of miscommunication about it, and of course it's cirrhosis. How are you, my friend?
I'm good. How about you?
Nice to see you again. Cirrhosis. This is not just an alcoholic problem, is it?
No.
If you're an alcoholic. So let's just talk about what cirrhosis is to begin with.
Yeah, it's very simple. Cirrhosis is scarring of the liver. And so there are a lot of different things that can cause the scarring in the liver. Alcohol is probably the most common, but the list is very long. You could teach a whole med school course on the different things that could cause
But
cirrhosis.
we, as the public, assume, and I know firsthand because I was telling you off camera, my grandparents started cirrhosis of the liver because they were a little bit of a drinker, you know, and complications of that as well.
Yeah.
But is there a cure to cirrhosis?
Kind of. Well, liver transplantation.
Really?
Yeah. So, but you have to meet certain criteria to get a liver transplant. But you want to not get to that point. If you're getting regular doctor follow-up, occasionally they will check your liver test and they'll be able to pick up on signs that you have some liver problems.
Well, let's talk about those signs because, you know, being from Australia, we like a drink. And I was saying that I don't drink a lot because I'll be honest with you, I have it in my head about my grandparents dying of cirrhosis of the liver. So mentally, I seem to stay clear of that. I don't know why, it's in my mind. How will you know if you are teetering on the verge of cirrhosis of the liver, and can you pull back and fix the problem?
Yeah, that's very good. Yes and yes. So your regular doctor is going to be checking blood work, and occasionally they will check liver tests. There's really nothing that you can do in the early stages of liver inflammation to pick up on that, like symptoms that you would have or anything like that.
Not yellow skin, bloodshot eyes?
That's yellow skin is way down the line.
Oh, really?
Yeah, so you want to be having those regular follow-up visits. And then if they find that and you stop drinking or stop whatever this insult is to your liver, then your liver is a very resilient organ. It can heal itself.
Really?
If you let it get to cirrhosis, though, you can't heal yourself from that anymore.
What is cirrhosis? Explain what it looks like.
Yeah, it's little, well, if you pull out the liver, you see little nodules and knots all over it. And so it's that scarring kind of contracts, and it just doesn't function well. You know, it filters your liver is supposed to filter these toxins out of your body. Another important thing I want to say is, remember, it's not just alcohol. Baby boomers, the CDC recommends that age group get tested for hepatitis C. It's so prevalent in that age group of people that, CDC wants everybody to get tested for hep C. And
it's interesting you say, at what age bracket? You're saying baby boomers because of hep C, but someone in their 30s, if they're heavy drinkers, is it hereditary?
Well, hepatitis C is not hereditary, but you can have some predisposition to cirrhosis that can be hereditary.
Right.
So, so a 30-year-old would not be worried about hepatitis C unless they have risk factors. And hep C is just one of the hepatitis. You know, there's A and B.
Yeah, of course.
But
I was talking more about the cirrhosis. Would you get cirrhosis in your 30s if only you were a big drinker?
Probably not.
Right.
Cirrhosis in your 30s is really unusual, but it's not impossible.
Okay.
If you had, say, hepatitis C at an early age and you were a heavy drinker, something like that could happen.
All right. Well, as always, you give us great information. Thank you so much.
Thank you.
If you want to find out more, there it all is up on the screen for you. Gastroenterology Associates of Columbus, Dr. Richard Hurd, joining us in the studio today. Back after this short break.